This is Dr. Sam Goldhaber for Clot Chronicles. We have just returned from the European Society of Cardiology meeting in Munich, the largest cardiology meeting in the world. And at ESC, we had the presentation of a long-awaited trial called Commander. Commander is a trial of heart failure in patients with a reduced left ventricular ejection fraction. That means that the heart muscle contraction is limited, and these patients often are plagued with shortness of breath and fluid buildup. For a long time, it's been thought that the addition of anticoagulation to the regular heart failure regimen of these patients might reduce heart attack, stroke, and cardiovascular death, and might reduce hospitalization for heart failure episodes. And in Commander, patients were randomized in a multi-thousand patient study performed around the world, either to very low doses of the blood thinner called rivaroxaban, and better known as Xarelto, or to a placebo, in addition to their regular heart failure medication. And it turned out that the primary endpoints of the study, namely reduction in heart failure hospitalizations and in reduction in cardiovascular mortality, reduction in heart attack, those were not met. But there was a very interesting 40% reduction in the stroke rate in patients who were randomized to receive rivaroxaban rather than placebo in the Commander study. So I think that while the overall approach of giving all heart failure patients with a reduced left ventricular ejection fraction did not prove successful in Commander, we got a lot of useful information in the one subgroup which had a spectacular response to rivaroxaban, and the group that had a 40% reduction in stroke. And this information will be useful for those heart failure patients who are at particularly high risk of stroke. And I think this information will also help us design future heart failure trials that target the use of anticoagulation in a more limited population than just the broad field of heart failure. This is Dr. Sam Goldhaber signing off for Clot Chronicles.